Okay, good morning, everybody. Thank you so much for joining us. I'm April Harrington. I am the project manager of the Chicagoland Healthcare Workforce Collaborative. I hope we have some more people joining us. I know we have several of our hospital partners on the registration list, but July, especially end of July, it's a tough time, I know. So I'm glad we're recording today, and those who couldn't join us can watch the recording afterwards. So today is our Progressive Pathways in Nursing Industry Convening. Very quickly, if you are new to the Chicagoland Healthcare Workforce Collaborative, we are an employer-led sector partnership. So we have 12 of the major health and hospital systems in Chicagoland at the table. 6 of those also sit on our steering committee, but we're also supported by more than 15, probably more than 20 strategic partners in the workforce development, training, and community organization space. And we come together in this collaborative to support an inclusive healthcare workforce. So to engage in local and targeted hiring so that we are developing specific strategies to build more opportunities for unemployed and underemployed populations. We're also trying to build stronger partnerships between our training providers and employers, and also focus on retention and career pathways. So we are focusing on the pipeline and getting students as well as younger students as well as adults into frontline positions in healthcare, but we're also concerned about ensuring that there are progressive career pathways that lead from entry-level jobs into careers and family wealth building careers. And that's something that we're talking about here today. Today we have 2 presentations. We usually have 3 in these industry convenings, so I'm excited that we'll be able to give a little bit more time to both of our presenters and a little bit more time to discussion. First, we'll hear from Dr. Kimberly Townsend, who is the CEO and president at Loretto in Syracuse, New York. And she helped her system build the first ever registered LPN apprenticeship. So we'll hear about that. She's also doing some exciting things with career pathways for CNAs that I hope she'll touch on. Thanks for joining us, Kimberly. And then we'll hear from the team at Rosalind Franklin University. Dr. Sandra Larson, I know, is joining us, and I see Dr. Lori Fuente is on the call as well. And they have built a nursing education to workforce pathway, which is a progressive model that takes students from the beginning of high school all the way through a master's degree in nursing. So I'm really excited about that sort of long range vision. And that occurs in Lake County. So please put all your questions in the chat as people are presenting. We do have time for questions and discussion. And then afterwards, I hope we can also open up the discussion to talk about, which of these models could we think about replicating in Chicagoland? What are the things that are really resonating with you that we want to replicate? As many of you know, Chicagoland Healthcare Workforce Collaborative might be receiving some grant money to launch our own pathway programs towards the end of this year. And these are the types of things that we could be investing in. So I'd love to have that discussion at the end. Real quick, I know that most of us here are probably very familiar with the nursing shortage, but I brought together some data points. Most of these are from this 2021 American Nursing Shortage, a data study from University of St. Augustine. I'll drop the link in the chat in just a moment so you have it. It states that, as of February of last year, registered nursing was the 5th most in-demand job in the US, according to LinkedIn. The US Bureau of Labor projects we'll need almost 200,000 every year between 2020 and 2030, with growth projected at 9%. And this is not just an American problem. The WHO reports that the world might be short almost 6 million nurses by 2030. And a lot of these studies point to retirement, burnout, and also the educator exodus as some of the reasons behind the shortage. We know that many of our nurses are aging. Nearly half are now over the age of 50. I think in the study, it states that nearly half have indicated that they want to retire within the next 10 years. Burnout and stress, I think we all know about, especially during COVID. Some of those retirements have occurred early because of COVID. Burnout and stress is also related to the number of patients that nurses see and the number of support staff that they have working with them. But then another problem is this educator exodus. This report found that over 80,000 qualified nursing school applicants were turned away from programs due to a lack of qualified faculty, clinical study sites, classroom space, and budget constraints. And that's, across the system. That's our training providers not being able to find nursing educators, as well as our hospitals not being able to open up more clinical sites, which is sort of this revolving problem. And that's something that we've talked about at this table and I've heard about before. And then in Illinois specifically, the American Nurses Association predicts we'll have a shortfall of 15,000 by 2025, just 2 years from now. And there was a Cranes article that was published just a few days ago, actually, that talked about how Chicago's hospitals are easing hiring standards to weather this shortage. They cited UChicago and Advocate Aurora and Sinai and the different measures that they're taking, specifically hiring, easing the qualifications from needing a bachelor's degree to needing an associate's degree. Also other sorts of programs like Advocate is launching a loan assistance program that helps nurses pay off their debt. So many of our systems are bringing in nurses with an associate's degree and encouraging them to continue their education once they've been hired. And I know that's not just occurring at UChicago or Advocate or Sinai. And I also pulled together some of these numbers from the Illinois Department of Employment Security. I mean, you'll see that we hire, mostly CNAs and RNs in Illinois. I was interested to see that the 10-year growth for CNAs and LPNs is not projected to grow, but certainly for RNs, it's at 12.4%. And this growth in our need for nurse practitioners at 31%, I found also surprising. This is, this career ladder that a CNA might earn about 35,000, whereas a nurse practitioner could earn over 100,000. And I also found this interesting that according to the US News and World Report's list of the 100 best jobs in America, nurse practitioner takes third. So this, hypothetically, if this is a career path, it ends up in a great job. So I'd love to talk about how we can get more people there. So very quickly, before I hand it off to Dr. Townsend for our first presentation, I'd like to just take a few minutes to open up the floor to a little bit of discussion of anything, that I just presented that is resonating with you. And also, what are you experiencing on the ground? Are there other factors that you think are affecting our nurse shortage? Are you changing your hiring practices or your training models to address this? And if you are changing something, is there anything that's making a difference? So anyone can feel free to just come off mute and jump in just for a few minutes.
Hi, it's Mary Schmidt with Midwestern Career College. Hi, the college is likely to enter the nursing arena in 2023, 2024. Prior to that, we have focused on allied health and have had a lot of success with our allied health programs. But we too have been watching the need for nursing careers. I was interested also in that Cranes article that you mentioned, April. And one of the things that I read, and I would like to ask the team here, is LPNs coming in and fulfilling some of the more basic functions that are certainly within the scope of practice of an RN, but on the lower end of that an LPN can also fulfill. And some hospitals and other organizations being creative in making room for LPNs where there traditionally has not been. So that's part one. Part two, having worked in the BSN space before, I know firsthand the deficit of clinical sites. And at the end of the day, there's only so many schools that any hospital can accommodate. And I've been watching over the last couple of years as hospitals have consolidated their resources. So they've had specialized hospitals where, pediatrics is only in a certain hospital in a group, like Advocate has for Christ and Lutheran General as an example. Therefore, with a number of programs out there, everybody needing pediatric, they're all knocking on these same doors. So my concern as we look to enter this space is, how will we find clinical space for our new students? And is LPN perhaps a better opportunity for the college?
This is Diana Helfer from the Ann and Robert H. Lurie Children's Hospital in Chicago. And one of the training practices that we have implemented is the development of an RN fellowship program. And it's for nurses with limited nursing or pediatric experience. We have an RN residency program that's been in place 20 plus years, and that's been very successful for onboarding novice nurses. But the pandemic accentuated nurses in school and graduating from schools with limited clinical experience, at least direct clinical experience, which was offset by high fidelity simulation. So those are some of the things we're seeing. We're doing the obvious things. We've increased the number of times we offer start dates and orientation. And we've done a lot of things around resilience and wellness for retention as well.
And that's good information. Thank you, Diana.
Yeah, thank you for sharing that, Diana. And Mary, thank you for bringing up this question of LPNs, because I know when I was coming into this space without much of a healthcare background, that's something that I heard about, was that we don't use LPNs as much in Illinois as some other states, or we've been phasing them out. But this Cranes article seems to suggest that maybe some of our employers are thinking about hiring more LPNs out of necessity. Does anyone else want to throw in any other comments before I throw it over to Dr. Townsend to talk about an LPN apprenticeship? Okay, well, we have plenty of time for discussion today and questions. So please, I encourage you to put questions in the chat as we're hearing from our presenters. And then we can have some just open discussion after each. Where did, Dr. Townsend, I believe I made you co-host, so you can share your screen and get started anytime.
Okay, great. Well, good morning, everyone. Just delighted to be here with you today. I'm Dr. Kimberly Townsend, and I'm president and CEO of Loretto, which is a post-acute healthcare system located in upstate New York. And just a little bit about Loretto. Loretto was founded in 1926 on three foundational principles: partnerships, innovation, and a desire to solve big social problems. And the partnership in 1926 was the Sisters of St. Francis in the Syracuse diocese. And the innovation was they created the first home for the aged in North America. And the big social problem that they were trying to solve at that point was that if you were aging in our community and you did not have family to care for you, you ended up being sent to the debtor's prison, the county poor farm. And the sisters and the diocese felt that that was an undignified end to a good life. So they opened up the original Loretto Rest, where they took care of 100 individuals in the community who were of the Catholic faith or no faith whatsoever. And so fast forward to today, Loretto still stands firm on those three pillars of partnerships, innovation, and a desire to solve social problems. And as I'll share with you today, this LPN apprenticeship program certainly fits all three on the mark. So Loretto as a system cares for roughly 10,000 people a year across 19 sites and locations. We have the full continuum of post-acute care. So we have subacute care, short-term rehab, long-term care, all in skilled nursing. We have a large housing portfolio with 8 different programs within that housing portfolio. And we also have a PACE program, which is a dual eligibles program where we are both payer and provider. Of the 10,000 people we care for each year, 70% of them are Medicaid eligible, meaning we are a safety net provider in our region. And we are the 4th largest health system in our region. As far as our employees go, we have 2,000 employees, and 1,700 of our employees are also SEIU 1199 members. So we are a union organization. And in addition to that, 65% of our frontline caregivers are women of color coming from the most highly impoverished zip codes in the United States, because Syracuse has the highest concentration of Black and Latinx poverty of any metropolitan area in the United States. So we are a small city with big city problems. And so something that Loretto feels very strongly about is growing our employees and helping them find those paths of prosperity by having robust career pathways. And we take a unique approach to doing that. We do most of our training internally. So we have long-standing CNA and home health aide training programs. And so it was a natural extension for us to have an LPN apprenticeship program. Now, our LPN apprenticeship program is through a partnership among our local economic development agency and also our BOCES program, which is a program which is part of the State University of New York. Of course, 1199 SEIU is a partner in their training and upgrading fund, and Loretto. And it's a team lift that it has been very, very successful. We're entering into our 4th year of this program, and we have graduated nearly 40 graduates from the program with a 90% NCLEX pass rate and an 87% retention rate to the organization, which I think for all employers is really something very important. And what's most notable about that is we do not require any of our LPN apprentices to sign tuition reimbursement agreements where they agree to stay with us for a fixed period of time. We felt that that was inappropriate given our workforce, and so we do not put handcuffs on people. So that 87% retention rate is something we're very proud about, and really shows that when you do programs of these types for your employees, they really are stickier to the organization. So what I would say about the program is, we continue to see highly robust demand for this program. So every year, because we are unionized, we have a bidding process. So this is an incumbent worker program, a frontline worker program. And every year we continue to see well over 100 individuals bid into the program for anywhere from 10 to now 15 slots in the program. And our limiting factor is there is only one LPN program in this area. So we have one training program with 20 slots in a day program and 20 slots in an evening program. And so speaking a little bit about the incumbent workers that are eligible for this program, these are CNAs, home health aides, could be dietary and food service workers, housekeeping and laundry workers, and our PACE drivers. So we really see this as a critical piece of helping people effectively double their income in a 15-month period of time when they go through the 10 months of LPN training and our LPN test prep program. Within 15 months, people can effectively double their income, which for our employees is a life-changing experience. That's the difference between living in one area and being able to move to another, getting your first car, buying your first home, sending your kids to college. So this is a multi-generational poverty eradication strategy that's central to Loretto's DNA and what we do. So a little bit about the details of the program. Our program addresses the one barrier that our employees have always identified to advancement in their programs, which is our employees simply cannot afford to not work while they go to school. But yet many of our employees have very full lives. And so consequently, that challenge of not being able to reduce hours or not work while they're in an LPN program, it was the primary barrier. So our program includes a wage stipend. So our employees spend 2 days a week in all day in their training program. They spend 2 days a week here doing on-the-job and enrichment activities on site. And then they work 1 day a week. So they take one shift per week and we fill in that gap with our wage stipend. I think that for us, we had tried to create an LPN apprenticeship program for 10 years, closely in collaboration with the Training and Upgrading Fund of SEIU. But we experienced barriers associated with scope of practice, primarily. As we were trying to have people who were not LPNs doing LPN work. And so it was finally through the technical assistance of HCAP, which is an organization that has a federal DOL contract to assist with healthcare apprenticeships. It was finally through their assistance that we were able to create a program that met muster and also met the needs of our employees, and we were able to launch our program 4 years ago. So our program, as I said, not only consists of classroom learning, but there is a very strong enrichment, mentoring, class preparation, and test preparation component to our program. So we have a dedicated director who serves in that role. And really does a lot of things. He is not only extending their knowledge beyond the things that they are learning in class, but he's giving them those other critical skills that all nurses need. Problem-solving skills, critical thinking skills, conflict resolution, rapid identification of changes of condition, prioritization of tasks, and emotional intelligence, all of those things which are so critical. We also have a very comprehensive test preparation program, which I think is why we have a very high NCLEX pass rate, which is also conducted by the director of this program. In addition to the nearly 40 people who have gone through this program in 3 years, an unanticipated positive benefit of this was we put out a survey across our system and asked if there were individuals who had completed their LPN coursework, but either had not taken the LPN exam, the NCLEX exam, or had not successfully taken the licensing exam. And we had identified several people across the system who fell into this category. And we offered that NCLEX pass preparation program to them as well. And we now have 17 new LPNs through that program, individuals who would have never have gone back to take the exam if we had not asked the question. And so we were very pleased about that. One of them had completed her coursework 15 years ago, failed the exam once and just figured, hey, I'm never going to be an LPN. I just don't have what it takes. And she successfully passed a year ago and is still with us today. So part of what we're doing here is, as I said, as we're speaking to our employees, and I think what all of us are hearing in the Great Resignation is really people are looking for 3 things. And our employees are looking for the same: flexibility. And so we have introduced a number of flexible work arrangements, which is a conversation for another day, and a deep desire to advance. I think coming out of COVID, if you can say we're coming out of it, I guess going from a pandemic to an endemic state, our employees are really hungry to continue to advance their careers, to better care for their families. And so we have created very robust career pathways, particularly for our frontline employees, but we are working through every key job description at this point. And so as April mentioned, we have also launched a number of CNA advancement projects as part of our CNA and home health aide career ladders. And so we are offering nationally recognized certification programs to our employees. And upon the completion of those programs, there is a wage increase attached to each of those milestones on their career pathways. So the 2 initial career pathways we've started with for our CNAs are an acute rehab or an advanced CNA pathway, which includes BLS certification, CPR certification, phlebotomist work, as well as other elements in that advanced CNA program. And then we also have an advanced CNA pathway for dementia, which includes the ALTS-EASE training, as well as TIPA-SNO training and Montessori dementia training for those employees. So these are things that we feel are very important for our employees, and we're happy to do that. And of course, the third thing all employees are looking for is an environment where they can learn and grow. And so this program serves all of those purposes. Probably the only things that I could mention to you otherwise about our program, short of questions, is the fact that I think what is the secret sauce for our program is that strong director position, because as we know, we are all dealing with adult learners who have full lives, families at times, work obligations, other obligations and interests. So that director serves a multifaceted role of everything from cheerleader to therapist to encourager to teacher to taskmaster. And so that has been part of our success and the reason that we have no fallout from our program. So we do not have individuals who become part of that LPN apprenticeship cohort that have dropped out. So there is no dropout rate. And then I think the other thing that I would mention, and April alluded to this, is there is a lot of money available through various sources to look at and to launch healthcare apprenticeship programs. There is DOL money, federal and state, there are economic development monies. And so for us, this is a program that has multiple streams of funding. There is economic development funding for this. There is, of course, the commitment on the part of the Training and Upgrading Fund. And then Loretto likewise puts in money as well. The total all-in cost per student, all in, training, preparation for the exam fees, books, wage stipend is $45,000 a year. But in an environment where all of us are probably still bringing in traveling nurses at $198 an hour, for us, that is an investment that has paid off in spades. Both because of the fact that we are building a pipeline within our organization, and we are building more capable and highly trained healthcare professionals in our region, but also for the great good that it's doing for our employees and their families. And so I'll stop there and be happy to take any questions or continue as April would suggest.
Thank you so much, Dr. Townsend. Yes, I'll get the ball rolling with questions, but everyone please feel free to jump in or just put questions in the chat. Dr. Townsend, I know that one thing some of our employer partners have struggled with is doing incumbent pathways in a unionized setting. And I know that you spoke about the bid process, but I wonder if you could give a little bit more detail, one, on how you worked with the union to make this work and any challenges there, and then two, the process of actually selecting the incumbent employees who are eligible for the program.
Great. Well, I think we were very fortunate because the union has been a partner from the inception, which was 10 years ago. I think the challenge, as I noted, in any apprenticeship program, particularly in healthcare, is that those scope of practice issues, right? To have people who are not LPNs doing LPN type of work. So that is certainly a conversation that every employer, particularly unionized employer, has to have with their union. What tasks do they see that are essential and unique to the LPN role? And what are those tasks that can be accomplished through on-the-job training in an apprenticeship program? And then the second question that you asked was, April, refresh my memory.
If you could just talk a little bit more about that bidding process and how you're choosing because I know you said that over 100 people show interest for 10 or 15 slots. So what does that process look like?
So, as in any bidding process, the first gate is seniority. And so our most senior employees have the first shot. And we cast a very, very wide net at the inception of the program in terms of people who might be eligible for those 15 slots. So we don't just take the top 15 based on seniority. we double and maybe even a little bit more than that, because not only is the seniority kind of the gating issue, but after that, there are a number of checkpoints along the way that are required by our education partner. So there's 2 testing requirements. Then there is an interview requirement. There's an application process. So there's so many milestones along the way. We find that sometimes people in the top 15 just cannot complete the process in the time required to do it. And then, so it's always good to cast a wide net. I think one of the lessons that we've learned is that in our process, in order to make it more transparent and also to make it run more efficiently, is we have started very early to recruit new cohorts. So our 4th cohort is getting ready to start classes in August, and we began to recruit that cohort in January of this year. So we put up the advertisements at the end of last year. The bid sheets went up in January and February, remained up, and then we started the selection process. And that was really to ensure that all of the people who really wanted to be in the program would have the opportunity to meet the requirements of the educational partners, the educational partner that we have.
And what are those educational requirements? I know that in the past, we have found with some incumbent worker pathways that folks weren't quite ready academically to go back to school. And at our community college in the city of Chicago that focuses on healthcare, they have sort of a level up programs that allow students to refine their, reading and math skills and get up to, the academic standard that is required to enter the program. Is that similar to what you're referring to?
That's exactly right. So this is a program, because they are adult learners, this is a program, and the testing is designed to identify individuals who may need remediation prior to entering the program. And so we do that remediation. So if an individual goes forward and they take the 2 tests that are required by our educational partner, and for some reason they do not come up to the standard that's required, then through the training and upgrading fund, there is a remediation program, and they're automatically put into the process in the next rotation. And that does happen. People have been out of school 15, 20, 25 years. And, it's a new skill set, right? It's a skill set that has to be redeveloped in some cases, and then people do so, and they're highly successful.
Great. Any questions from the audience?
So I see we have a number in the chat. Let me pop those up.
Is there an expectation to go back for a BSN after working on the LPN?
Well, there's always the opportunity to do that, but there's no hard or firm expectation on the part of our employees. But what I would say is we have had several of our LPN graduates say to us, while I'm in the school mindset, I'm just going to keep going. And so we have higher education partners that we work with to help our employees make that leap from an LPN into, a BSN program. And that frequently takes the form of a 1-2-1 program, right? Where they may get their LPN training and then spend time at the higher educational institution doing that additional coursework.
is there a monetary incentive to do so, to continue that at the BSN?
Well, that's something that we're looking at. At this point, we have a generous tuition reimbursement program. We also have partnerships with 2 higher ed institutions that give discounted rates on credit hours for our employees and all first responders and healthcare workers. And then I think what's most reinforcing from a monetary incentive perspective for our employees is just the tremendous lift of going from being a home health aide CNA to an LPN, and then that increase again once they become an RN. I would say here we have CNAs within our system that make $100,000 a year. If you're willing to pick up shifts, and you can do that. And likewise, we have LPNs here who make over $150,000 a year. So people see the value in this. But that's something we've discussed. I know we offer sign-on bonuses for LPNs, CNAs, RNs. How would we do that with our new LPNs, right? And that would be something we would have to negotiate. Or is that wage stipend really sufficient consideration to have them stay? And up until now, it has been. We've had no complaints regarding not receiving a bonus for completion at this point.
And I see we have one more question in the chat. Are there particular departments or facilities that your LPNs are working in? Or are they throughout the hospital?
So we're a post-acute health system. We're not a hospital. We're not acute care. So they work within primarily our skilled nursing, and they rotate through both our acute care, our acute rehab unit, as well as our short-term rehab unit, as well as our long-term care floors as part of their rotation. As part of their training, however, as LPNs, of course, they have clinicals at local hospitals.
And I'm guessing that some of the reasons we're getting these questions from Christina and Mary are this question of, are we using LPNs in our system, or where? And I know we have some representatives from Lurie and from Rush and from Advocate and UI Health here. Could any of you shed light on if you're using LPNs anywhere or thinking about using more LPNs?
Hi, this is Janet Stifter from Rush. Currently, we only have a couple of LPNs on our staff. One of those in the ambulatory area, one in the rehab program. We really have been doing more of a focus around our CNAs and doing pipeline programs with our CNAs and other non-nursing personnel who'd like to get into nursing. We're doing what we call a PSA, patient care tech pathway, but not LPNs at this point. But this has been interesting to listen to, so thank you.
Yeah, and there was a strong desire in this area after the IOM report on nursing, which came out, 10 years ago. There was a strong desire on the part of the hospitals in this area to really only use, BSNs, right? To certainly have RNs, but preferably four-year trained RNs. Unfortunately, the RN demand in our area far outstrips the supply. So for every RN looking for a job in the upstate New York region, there are 29 open positions. So there's still a heavy reliance by our acute care partners and using LPNs in their facilities, and indeed they frequently recruit from us given our training programs, because they know that our LPNs are well prepared. In terms of coming up, that's an interesting point that you raised, Janet, around creating roles that do not require certifications, as in a CNA. We likewise have done that. That's called, they're called support service workers or temporary nurses, aides in other cases. And that really is to bring people in and to continue to build that pipeline for people who may not yet be ready to enter a clinical profession, but yet want to be in the healthcare setting. And so we found that those programs are likewise excellent feeders for both our CNA and home health aid pipelines, as well as eventually the LPN apprenticeship program.
Okay, any final questions for Dr. Townsend before we move on to the Rosalind Franklin Pathway Program? Anything else you'd like to share, Dr. Townsend?
No, just thank you so much for your time today. Really honored to be able to speak to you about our program. And of course, if you have any questions for me, you can feel free to address those through April. And I'm happy to be helpful as all of you are exploring ways to continue to grow your people and your organizations.
Thank you so much for taking the time to talk to us today. I really appreciate it. Thank you, Dr. Townsend. You're welcome to stick around, but of course I understand if you have other things to get to. And with that, I'd love to pass it over to Dr. Sandra Larson and Dr. Lori Fuente from Rosalind Franklin to talk about the nursing or education to nursing pathway. I'm not saying it right, but you'll correct me, Dr. Larson. And you should have permission to share your screen if you have.
Okay. So thank you so much, April. And thank you everyone participating in this meeting for the opportunity to talk with all of you about our nursing education to workforce pathway. And just really quickly, my name is Sandra Larson. I'm the founding dean for the College of Nursing at Rosalind Franklin University, and also vice president for partnerships. And with me today, as April was mentioning, is Dr. Lori Tenty, who is our chair program director for our Masters of Science for Entry to Nursing Practice. And that is part 3 of our 3-phase nursing education to workforce pathway. So if I may, I think the other thing I'll share with you very quickly is for those of you who might not know about Rosalind Franklin, we are a graduate level health professions university that is located in the northeast corner of our state. So we're the most northern county, Lake County, so the northeast corner, and our university itself is located in the city of North Chicago. So if I may be so bold as to start this presentation by telling you a personal story. So I've been a registered nurse since 1975 and a nurse anesthetist since 1983. And my first job as a nurse anesthetist was at Loyola University Medical Center. And it was back in '83. And at that time, we were doing about 2,500 cardiac surgical procedures a year. And that wound up being my area of specialization. But when I wasn't doing cardiac anesthesia, I would occasionally give anesthesia for general surgical procedures. And there was a general surgeon who was really amazing. And he expected all his surgical residents to bring their A game every day. And when a surgical resident didn't know the sequence in the surgical procedure, the sequence of steps, or they didn't know their surgical anatomy, he would very sarcastically say to them, "Yeah, why should it matter? It's just a human life." And he was right. It's a human life. And that's why knowing it should matter. And our team was having a discussion about all the level of time and investment and passion that we've put into this nursing education workforce pathway over the last 3 years. And we realized, why are we doing this? especially at Rosalind Franklin, why are we investing all this energy in youth in Lake County for upwards of 8 years before they'll ever come into our Masters of Science in Nursing program? And we realized it's because it's about a human life. And the data in Lake County shows that our youth who are hailing from our high hardship index zip codes are not achieving education attainment. And if you have low educational attainment, we all know you have low health. So this project is about the youth of Lake County and coming together to leave no one's life behind and to help them achieve educational attainment so that not only are they building the future nursing workforce for Lake County, but they're also building the health equity of Lake County. So think of these youth, these faces, as some of the youth in Lake County that we seek to serve by the new pathway. So Lake County has 27 zip codes, and 9 of them are designated as high hardship index zip codes. And they're North Chicago, Waukegan, Zion, Winthrop Harbor, Highwood, Round Lakes, Mundelein, and Ingleside. And high economic hardship communities, and Lake County is no different, have poor physical and mental health and lower life expectancy. Now, here is a picture, and actually let me take this so you can see. Here is a picture of Lake County, and these purple areas are the high hardship index zip codes. You see this green circle, that's Rosalind Franklin University, and we're located right on the southern edge of North Chicago. And the red circle that you see is Lake Forest College, which is located 4 miles away from us. And together our 2 academic institutions have come together to create this nursing education to workforce pathway. So we have learned that roughly 13,000 high school youth live in Lake County's high economic hardship zip codes, and they are served by 7 public high schools. And youth attending 5 of these high schools are between 78 to 93% Black and Hispanic. And these high schools have a report card rating between B to C-. Youth living in Highwood are majority Hispanic, but they attend Highland Park High School, which not surprisingly has an A+ rating. Mundelein, the remaining high school, is 40% white, 46% Latinx, and has an A rating. Now, our high school survey data and our conversations with high school counselors show at least 5% of these youth want to become nurses. That is to say, right now, we have 650 youth living in Lake County's high economic hardship communities who dream of becoming a nurse. These counselors also tell us these youth want to attend college close to home and stay and live in their communities. They live in zip codes where 1 in 4 adults holds a bachelor's degree, compared to 3 in 4 for our wealthier zip codes, where the median per capita income is $27,000, the median family net worth is $125,000, and where they by and large attend high schools with lower resources. So what's the likelihood they're going to find their way into RFU's Masters of Science in Nursing program if we don't build an innovative educational pathway uniquely tailored for them? So helping each youth achieve their dream of becoming a nurse will have a tremendous ripple effect for Lake County. Each youth who progresses through the pathway will contribute to health equity in Lake County simply by overcoming its root cause, low educational attainment. Each will contribute to Lake County's critical nursing workforce shortage individually and by recruitment of other youth through their example. And each will promote economic development and health literacy in their communities when they work, learn, and live in Lake County. In addition, our ability to interface with them during the pre-nursing years will improve our retention rates and the caliber of our graduates. The new pathway that we've built is a very bold vision, and it requires a holistic and long-term relationship with the student. And such a commitment is necessary to make a meaningful impact on their educational achievements and professional development, and to ensure they remain in the pathway. Aligning a broad network of community organizations and community members who are committed to engaging and supporting the nursing pathway students and their families has been essential to our success. And so we have brought together members of academia. So, for example, outside of Lake Forest College, we've brought together our junior colleges to play a supporting role. We even brought in the Illinois Institute of Technology, and they're helping us as we go out in the community talking with high school counselors, high school students, and their parents about what phase one of the pathway should look like that we're building for them. So academia, we've brought together business, government, healthcare, and community members. So these are some examples of our partners, and many of them are providing internships during phase 2, or there are clinical training partners during phase 3, for example. And we, with our, for example, Lake County partners, several of them are helping us with securing financial resources. So what is this pathway? Well, it's really 3 phases. Phase 1 is during high school. Phase 2 is during the pre-graduate undergrad experience that they have at Lake Forest College. And then phase 3 is our Masters of Science for entry into nursing practice. Now, phase 1, which is occurring during high school, includes 4 programs: Science Saturday 1, 2, Nursing Inspire, and training to become a certified nursing assistant. An application for phase 1 of the program is offered to youth at the end of their freshman year who are attending the high schools that are serving our high hardship index zip codes. Learning and supportive experiences that are offered to these students in these 4 programs are really designed to enable them to overcome the barriers identified by the community itself, and ensure their successful progression through the educational system. And conceptually, these sort of fall into 5 main areas of consideration: the students' need for employment during high school, their need for holistic or mosaic mentorship that promotes inclusion, physical and mental wellness, and awareness of the opportunities that they have, academic support to improve their math and chemistry aptitude, financial planning, and support to overcome educational costs. And then also greater knowledge about the nursing profession, the opportunities within it, and awareness of the advantages that are afforded to a master's prepared nurse. When we look at phase 2 now is occurring once they graduate from high school. And at that point, these Lake County youth will have an opportunity for conditional admission from high school into phase 3 of our program, so into our nursing program. As long as they hit benchmarks during the undergrad, they are guaranteed admission. So one of the things we heard the youth say is, we do everything right and we apply and we're still not accepted. So these youth have a pathway that's already been developed through College of Lake County as well as through Lake Forest College. And we evaluate their high school record. And if they apply a year later through College of Lake County, we also evaluate their first year at Lake County, and we're providing them with conditional admission as long as they hit certain benchmarks. At Lake Forest College, we've built with them a nursing professional development program. So right out of high school, if they start as a freshman or if they start as a transfer student at Lake Forest College as a junior, they are automatically, and they're admitted into Rosalind Franklin's nursing program, they automatically have this continued holistic mentorship that is part of the nursing professional development program. These students also take the health professions program, which is a program that we built jointly between Rosalind Franklin and Lake Forest College. The students take courses taught by us that teach them about interprofessional health care practice, teaches them about social determinants of health. And then, of course, they have the ability to earn their baccalaureate degree either in 3 years or either through a 3+2 pathway or a 4+2 pathway with us. So during this second phase, they're earning a really solid foundation in the liberal arts, which we think is successful for nurses. They can earn degrees in pretty much every area that Lake Forest College has, short of maybe physics and maybe a mathematics degree. So they'll take 3 years through a 3+2 pathway at Lake Forest College, then start their 4th year at Rosalind Franklin. That 4th year transfers back so that they can complete their degree, complete the baccalaureate and the Master's of Science in Nursing in 5 years. And then, of course, once they start in our program, we once again, ongoing mentorship, nursing professional development, health system collaboration. They graduate with that Master's of Science degree. All 3 phases of this pathway have their own directors. I really appreciated the point that Kim made about the need for there to be organizational structure around how you're implementing these programs. And what's our goal? Our goal is that by 2032, each year, 225 Lake County youth will achieve the following. 100 will graduate from phase 1, 75 from phase 2, 50 from phase 3, and 50 RFU nursing graduates overall will join Lake County's RN workforce each year, MSN prepared. And at this point, I'll stop sharing there and hope I've given you enough information to perhaps ask questions. There's a lot of moving parts to this, and it's hard to explain in 15 minutes, but hopefully that's given you good background on what we're creating and why.
Well, thank you, Dr. Larson. When I heard about this, I was just so impressed that you were taking, such a long range approach and supporting students from out of freshman year in high school all the way through master's degrees. So I think this conversation we're having about nurses is, do we want to stop taking, RNs who have bachelor's degrees and take nurses that have associate's degrees? What about the quality of care? What about those that are trained at the level where they can take on leadership roles and become educators themselves someday? And this pathway, brings students all the way through their masters. And I just think that's really impressive and something I don't see very often. I'll give everyone a moment to think about your questions, and I'll ask, could you speak a little bit more about the funding and how you're able to support, especially through, I think the last time we spoke, you mentioned that the bachelor's degree was almost entirely funded, and the master's might be where some of these students take on a little bit of debt, but could you speak a little bit more about that?
Sure, I'd be happy to. So if we just think of the end, go to the end of the pathway, it's our goal for each of these students that they will graduate with no more than $50,000 in debt. And if you graduate with $50,000 total dollars in debt, you are financially healthy because you can very easily pay back that student loan over a 10-year window and have it not be more than 10% of your earning potential. So it winds up being even less than that. So we first started with what's the end goal, and that was our end goal. And now we're working backwards. So we're doing philanthropy, and we've raised several million to support the students. So philanthropy is one of the places where the financial piece is coming in. Another is we're working with Lake County Workforce Development, which administers federal funding at the state level. We are getting our university and Lake Forest College's university approved to receive funding from them, and they will support tuition costs for various things, for what's happening at the master's level, helping pay tuition at that level, as well as helping to cover costs for tuition at our tech campus when they get trained to become certified nursing assistants. Also during high school, during Nursing Inspire, that's a 4-day-a-week summer program, and those students are getting stipends. So through grant funding and also once again through government funding, we're working to secure stipends. So philanthropy, federal and state funding. The third is really this piece about providing students with employment where they can work and earn to save towards their tuition. Many of them, but not all, also need to be contributing to the family, but giving them employment that not only is earning, but helping them develop as a nurse. So the expectation is that students in this program, once they become CNAs, will work on average 8 hours per week in that role with one of our health system partners. And then the next thing we're doing is we're in collaboration with our health system partners in the area to look at the sorts of packages they can put together to support students who then come into their system and work 1 to 5 years and get tuition reimbursement for debt that they've already incurred. So that's how we're approaching that topic. It's interesting too, and certainly the other thing we did was built a way that they could go from high school to a BA, MSN in 5 years. Because the other thing our community was telling us is often to get an associate's degree, it's taking them 3 to 5 years. So if we can, for that student who's interested in achieving their education in this sort of way, for that student, if we can just have the community wrap their arms around them in ways that overcome those hurdles and give them the boost they need, it's absolutely achievable. And our health system partners were telling us we really need a well-educated nursing workforce, and we need a diverse nursing workforce. And often if we're looking for diversity in our nursing workforce, they're because of the financial situations are more inclined to go the associate degree route first. And they will not be able to hit the ground running as fast. They'll continue their pathway through the educational system. They'll earn their BSN. They'll ultimately earn, hopefully, a master's, but it's going to take them longer. I was an associate degree nurse grad, and now I have a PhD, but I think, man, I'm 68 years old and I'm just hitting my peak. And I wish I had started and hit my peak when I was 35 or 40. So I think, the nursing shortage is a huge challenge, and we need to game the system at every point where we can game it. And this is just one additional way. Lake County never had a college of nursing before, and we were not in Lake County graduating nurses other than at the associate degree level through our junior college. And so we're adding to the stream by which nurses can enter the workforce. and serve the healthcare systems that we have in Lake County.
Sandra, if I could add, I heard a study today that 72% of people live within 25 miles of where they grew up. And our goal at Rosalind Franklin is to teach providers to improve health outcomes. And the only way we're going to improve health outcomes in these zip codes where these students are going back to live is to increase their educational preparation, which in turn improves the patient outcomes in those zip codes, as well as improves the economic status of those students and their families. So like Sandra was saying, eventually they may get to the master's level, but if we can get them to the master's level much earlier and they can start accruing a higher salary to start with, they've got a much better chance of improving their own health outcomes, as well as improving those of their family members, their neighbors, their community.
Does anyone have questions for our presenter? Or any thoughts on how we could expand this model across Chicagoland? Well, that is one question I had is Rosalind Franklin actually increasing the total number of people graduating with a master's through this program? I suppose you're not perhaps quite there yet with your first group, right? But are you opening more slots than?
Yes. So when you look at this pathway, we're really in our infancy with this pathway. We've rapidly built 3 phases. I think our progression has been really rapid. We just had phase 3 approved by all the regulators. So the first group of students in phase 3 will start in February of 23. So yes, every one of those graduates is going to be a new nurse that Lake County would not have previously had. Phase 2, we completed that phase and started students entering into phase 2 a little over a year ago. And we graduated this in May, 48 students from phase 2 of the pathway. Phase 1 of the pathway, we've had in place some of the programs at Rosalind Franklin for between 3 to 10 years. So in our Research Inspire and in our Science Saturday 1, that's been a very successful program. Now what we're doing is we're expanding that, and we will be matriculating students into that program who are uniquely interested in nursing. So we're expanding the volume of students in Science Saturday 1 and in Inspire, and we're building 2 new programs, Science Saturday 2. And I mentioned in the presentation about the work we're doing with the Illinois Institute of Technology, Institute of Design. I'm just so impressed with them and didn't appreciate before that their area of expertise is in helping you design the student experience or the patient experience or the customer experience. That's the work they do. So we received a grant to partner with them and go into our community and learn how they would like us to design these 2 new programs that are in phase 1. And that work literally finishes next week. Our analysis of what the community told us finishes next week. But I think, one of the things for Lori and me that really was an eye opener or just became more tangible is how much the students, the youth are telling us we need mentorship. That's not the word they're using, but they're saying that they need mentors that are of all kinds. They want a mentor who's 2 years older than them, who can say, yeah, this is how I did this one thing that they're going to have to do. They want a mentor who's already in a nursing program, who's saying, don't worry, I failed at this too, but then I got back. They want a mentor who's wise, who's old. So really what they're describing is this mosaic mentorship pattern. And we were thinking initially, oh, we're going to build it around science curriculum. And it was like, whoa, a huge part of this pathway is mentorship, 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 mentorship. And we interviewed parents too. Parents told us very similar kinds of ways in which they needed to be mentored. They really, many of these first generation parents don't understand the opportunities that their children have. And the children were telling us, our parents just know lawyer, nurse, or doctor, nurse, or doctor, lawyer. They don't know how to help us. And so you could hear the youth saying, we want our parents to also kind of walk this journey with us and be included. So it's just been a fascinating and enjoyable experience with the community as we've had these focus groups with them.
That's great to learn about. I'm impressed too. I would love to perhaps get connected with those IIT folks and engage them in our process of planning a pathway program.
The other part that we've intentionally done is we're building a faculty that represents the student population. So we're making sure that our faculty are male, are people of color, are of various different backgrounds, so that the students don't feel like, they're being taught by someone who doesn't represent them. So, because that is important.
That's wonderful. I know we only have a few minutes left. I am going to drop a link to a brief survey in the chat that just asks for some feedback on the session, but also asks to share any of your thoughts on what types of pathway programs in nursing, if CHWC has some funds to build, what kind of models should we go for? What kind of strategies should we elevate? And let me just open the floor then in these last few minutes for any ideas around that. Like many of you know, we might be getting some funds to build some pathway programs. So do we want to do something similar to an LPN apprenticeship? Do we want to do something similar to what Rosalind Franklin and Lake Forest College is doing and really take that long view and work with students and put them all the way through a master's degree, or feel free to bring up something else. If would you like to build a CNA pipeline? Any and all. And I'll drop that survey link in the chat in just a second, but anyone feel free to jump in.
Well, hi, it's Mary Schmidt with Midwestern again. I just want to invite the people on this call to feel free to reach out to me as we are trying to navigate our pathway into nursing. We would love to hear from some of the partners on the line today about what they're looking for. We're pretty malleable right now in terms of how we're approaching it. And we're really looking to see what's going to best serve the medical community. So I'm going to put my email in the chat and would welcome conversations. Thank you so much.
Thanks, Mary. And if there are, I don't know, some very specific things you want to have conversations around, let me know. And I can try and integrate that into steering committee meetings or perhaps another CHWC meeting. I know everyone's excited to hear that there's another nursing program opening in the city. So I put the survey in the chat. Please take a few minutes. I will send out this recording, if not tomorrow, by the end of the week, by Friday, to everyone who registered for this event. And I'll include the survey link there as well, for those that had to drop off early or those who couldn't be there today. I want to thank again Dr. Larson and Dr. Tinty. Was that right, Dr. Tinty? Sorry about that. Thank you so much for being here. I would love for you to continue to engage with CHWC. I hope we can expand on what you're doing, and thank you so much for your inspiring model and for sharing that. And thanks to Dr. Kimberly Townsend, who had to leave. Thank you all. I guess let's have everyone have their 5 minutes back before 10 a.m. Have a great rest of your Wednesday and a good week. And feel free to reach out to me with anything you'd like to talk about with CHWC.
Thank you.
Thanks, everybody.
Thank you.
Thank you.